New York City is stepping up efforts to prevent the spread of coronavirus by requiring travelers from 19 hotspot states to fill out health forms when they arrive or face serious consequences.
If you leave the airport without filling out the information, not only can you have a $2,000 fine, you can then be brought to a hearing and ordered to complete mandatory quarantine.
This is in addition to the 3,000 contact tracers who are already keeping tabs on New Yorkers who test positive for COVID-19. A lot to talk about this morning, so joining me now is Dr. Ted Long, who is leading the city's Test and Trace Corps with an update on how things are going. So good morning to you, Dr. Long. Thanks for joining us.
Good morning. Thanks for having me.
It's one thing to get off a plane, sir, and get that form, right? You're easily tracked in an airport. But trains and cars, that's something a little different. So how do you see this playing out? How can you monitor people who are traveling that aren't necessarily flying?
Yeah, that's a great question. So the basis for all of this is we want to offer people as much testing as we can. So whatever mode you're coming in with, the only way we're going to really know if you have the coronavirus is if we can bring you in for a test. So right now, we've actually tripled the number of tests we're doing per day compared to when we started all of this. We're doing more than 30,000 tests of New Yorkers every day across more than 200 locations, and they're all free of charge. So we may be calling you if you got off of a plane or if you get off of a train, please do come in for testing.
But I'm going to challenge you a little bit on that because of what Dr. Jay Varma said in regards to the testing, right? He said that this is becoming a problem. We're seeing a longer turnaround time for certain labs. So if you come back from one of these hotspot areas, you get a test. For example, one couple in Park Slope that was reported in Gothamist waited 7 days to get their results. That's a lot of time that they're out and about.
The bottom line there is this is a serious issue. Across the country, states and cities are surging. We know what that's like in New York, and that's a real hard place to be in. That's why we're seeing the delays in terms of how long it takes to get your lab result back. That said, we've known this day might come for a long time, so we already have plans in place that we're operationalizing now. And the single most important thing that I'm going to tell you is that if you want to get a test today, come to one of our more than 50 testing locations within New York City Health and Hospitals, because our turnaround time is half of that of other labs across the city, because we have multiple labs we work with, knowing that this day might come. But this is a serious national challenge, and we all are, our thoughts are with all of the other states and cities that are going through what New York went through before.
When you say it's a shorter turnaround time, you're saying like 3 days rather than 7.
Half, yeah.
Okay, so in that time frame of those 3 days, are you urging people who have traveled to stay home while they wait the results?
Exactly right, yeah. If you're coming from one of the designated high-risk states, we do want you, and as the governor said, to quarantine to keep other New Yorkers safe. We want you to also get tested, but none of that changes the fact that you need to and you have a mandatory quarantine period.
So let me ask you this now. The numbers show that you've reached 94% of people in your tracing program who have tested positive. That's a real high number. Does that mean phone calls, visits, both? Walk me through a little bit of the process there.
Yeah, so we started off with phone calls. And the interesting thing with phone calls is I remember when we spoke at the very beginning of all of this, we were getting through to a decent chunk of people, but we've actually improved in the number of people we've gotten through to, and we've improved the number of people that are willing to give us the sensitive information, people that they may have exposed, even friends or family members. I think that's because we're building trust. Look, at the very beginning of this, we made the decision. This is going to be New Yorkers helping New Yorkers. Our 3,000 tracers, more than half, are from our hardest hit communities across New York City.
Right.
This is New Yorkers coming together to help each other. And I think that's why we're seeing the success we have with the program so far.
The latest numbers show 350 people tested positive for COVID-19 in New York City. So will they all be traced? How do you select who you call? And how long from the moment they get those positive results do they receive that tracing call?
Great question. So it's an easy answer. We trace everybody. And so we're reaching almost everybody now. We're going to share some of those numbers later. But actually, we're reaching the majority of people that we reach even within 24 hours, which means we're catching them as soon as we can. I'll give you an example of why this matters. When we reach our cases, when we ask them for people that they may have exposed or contacts, We then call the contacts, and we found that there's a group of already in the last several weeks alone, since the program started, more than 1,300 contacts that when we called them were already symptomatic, meaning if we did nothing, if the program did not exist, they'd go out there and infect on average 3 other New Yorkers each. So 1,300 times 3, we believe that the program's existence, even so far, has prevented up to 4,000 new cases of coronavirus. I'll give you another piece of data about why that matters. New York City's reopened. People are out there. People wearing masks. We have not seen a spike in the number of new cases. That's because New Yorkers are earning this. This is not us. This is not me. But our program is there to help.
Dr. Ted Long, appreciate your time this morning, and that's why that turnaround time for those tests is equally as important. Appreciate you and what you're doing.
Thank you very much.